Hi guys, welcome to my channel, your trusted channel for IVF and surrogacy. I'm Ethan, an embryologist living and working in North America. If you have questions about IVF or surrogacy, feel free to contact us. Now, today's topic is for the men out there. Do you really understand how much pain your wife goes through during the IVF? Over the years, I've worked with many couples going through the fertility treatment, from all walks of life, all kinds of background. And from those conversations, I've learned a lot. Two things really stand out to me. First, people feel pain very differently. Second, when it comes to infertility and IVF, men and women are definitely not treated equally. Let's be real, women go through way more physical and emotional stress in this process. Let me explain. First, the pain of egg retrieval. So what's the most painful part for the IVF journey for a woman? Without a doubt, the egg retrieval procedure. Here's how it works. A physician uses a non-needle guided by ultrasound and insert it through the vaginal wall to reach the ovaries. The needle then punctures the follicle on the ovary to suck out the fluid that contains the eggs. That fluid goes into a test tube, and we, the embryologist, look under the microscope to find and examine the eggs. Sound painful, right? Yes. Even though I've never personally experienced it, just imagine it makes me wince. Now, some women choose to do egg retrieval with anesthesia, and they don't feel a thing. But surprisingly, many women go through the whole thing a week without any sedation. And here's what I've noticed from the lab next to the OR. I can hear everything. Around 17% of women, honestly, they barely make a sound. They're calm, answer the physician's questions, even chat with the nurse. Some even try to sit up and walk away when it's done. Another 20% say things like, ouch, that hurts a little, but still power through it. But about 5% of fear, and this is hard to hear, are in extreme pain. I've heard women scream, cry, beg the doctor to stop. There was one time back in China, a physician had to warn a patient, please don't move like that, you will break the needle inside you. That's when I truly realized pain is personal. What feels bearable to one person might feel unbearable to another. Now let's talk about gender equality, IVF edition. Now on to my second point. We all talk about gender equality. It's a noble goal, but in IVF, it's not equal at all. When a couple comes to me for IVF, I always say, this is a team effort. You both need to get tested and go through this together. But let's be honest, the woman carries 99% of the burden. Guys, what's your role in this process? You get to sit in a private room, air-conditioned, holding a cup, maybe watching videos, and produce a sperm sample, and that's it. Now let's talk about what your wife has to do. Blood test, ultrasound, vaginal exam, cervical exam, all routine. Ever heard of a hysteroscopy? It involves opening the cervix and inserting a scope into the uterus. Women say it's one of the most painful procedures they've ever had. Some patients wish their husband could experience it once, just to understand. Then comes ovarian stimulation, daily hormones injections to grow more eggs. Some women breathe through it. Others experience nausea, bloating, mood swing, even ovarian hyperstimulation syndrome, which can be painful and cause fluid to build up in the abdomen. After that comes the egg retrieval I just described. Painful, stressful, and mentally exhausting. If all goes well, she still has to go through the embryo transfer. Then wait with hope and anxiety. Will it stick? Will I be pregnant? Some women are lucky. It works the first time. Others go through it again and again and again. I once met a patient who had done 9 egg retrievals. 9. Can you imagine the toll that takes? So what can men do? So guys, let me be very honest with you. IVF is not just about producing sperm. It's about being a real partner. Support her, walk with her, sit with her during the appointment, listen when she's anxious, hug her when she cries, and most importantly, help her feel emotionally safe. Because guess what? Her emotional health actually affects IVF success rate that's backed by science, not just feelings. So the final thought, We talked a lot about equality, and it is something worth striving for. But in IVF, women carry the emotional and the physical weight of this journey. So as husbands and partners, we need to step up. Be there, be kind, be strong. And if you do, you are already giving your future child a great start in life. That's it for today's episode of Can Baby. If you found this helpful, please give it a like and subscribe to the channel. I will see you next time, and I wish every couple out there a successful, smooth, and love-filled IVF journey. Take care.